Okay, on page 120, we're going to talk about decontamination, point of use preparation, and transport. In the introduction, it states that reusable instruments and other medical devices that are processed in CS are transported to patient care and treatment areas where they are used in a wide variety of procedures and applications. Probably goes without saying. They get used and then they get bloody. If you look at the picture on the top of page 120, this is an example of an instrument that was used in a in what they call a hemiarthroplasty. I recognize the instrument. Yes, it gets very bloody. And what you see on there, the blood and what kind of looks like strawberry jello is body tissue. It's gross soil. The blood smears on the plastic tray, that's gross soil as well. So gross soil is blood, body fat, and other body substances that are left on instruments. So the goals of point of use preparation and transport means that the gross soil should be removed at the point of use. And my coming up in this industry, I was used to getting instrument sets that looked like crime scenes. But that was never good for the instruments. It is not good for the instruments, it's not good for the process, and it's not good for patient care to leave all of that on. So more focus, more attention is being paid to actually doing things the right way, beginning at the point of use. And you are not there, that is the surgical technician. So this stuff is really what we need to try to make sure that surgical technicians are doing. Okay, another goal is to prevent damage to instruments, not leaving things in precarious positions. Prevention of cross-contamination, very important. When you're transporting soiled items through any part of the facility, there's always the potential for cross-contamination. So we can reduce that potential for cross-contamination by putting the things into a cart that has doors that shut, or into a red hard-sided container that has a lid that closes. And of course, keeping others safe, very important. Sources of contaminated items. Most of the contaminated items that we're going to deal with come from the operating room, which is the largest customer of ours. Others include the labor and delivery department, the emergency department, endoscopy, cardiac care, and basically anywhere where they could be using items that need to be returned to us. Even X-ray can sometimes use items that are going to end up becoming soiled and then will have to be returned to us for processing. So because the operating room is the supplier of the largest amount of soiled instruments, it makes sense logistically to put the decontamination room as close to the operating room as possible. So this is going to help reduce the amount of potential for cross-contamination of the environment. But also, the quicker we can get things to the point of real cleaning, the better off it is for the instruments, for the process, and for the patients. Okay, in order to achieve transportation, we have things like dedicated elevators. You might have an elevator that goes up out of the clean side of your department and into the operating area. And then one that comes down onto the dirty side in decontamination. These elevators are for different purposes, and dirty should never go into the clean elevator. And if clean goes into the dirty elevator, then that clean automatically becomes cross-contaminated. Does that make sense? I hope it does. So often things that were used in patient care are put into a holding area, a designated holding area, until somebody like one of us CS technicians can go and pick it up at our routine or regularly scheduled time. Things that are held in a holding area should be held behind a shut door. There should be biohazard signage on the outside of the door warning people of what's inside, like the pictures that you see on page 121. Contaminated utility room, authorized personnel only, and then a biohazard symbol, which is a pretty cool tattoo idea right here. Okay. there's other things that are going to be stored in here, like the leftover jellos that the patients didn't eat, and blankets from the bed and other things. So it's a general purpose utility room, and they always smell very bad because of the combination of things that are in there. Just, you know, FYI. Okay, point of use preparation. Instrument decontamination begins at the point of use. Should begin at the point of use, truly. Now, many hospitals and healthcare systems are currently trying to make sure that this happens 100% of the time. In the case of the picture on page 120 where it says gross soil, some items it happens less frequently. Consider that many of these items are rasps, and you cannot take like a gauze sponge and clean a rasp with it because it's just going to tear the gauze sponge. But general surgical instrument sets and most of the items really should be, the cleaning should be getting at point of use. So this chapter is going to go into a little bit more on how to achieve that. So the reasons, why are we doing this? Because it helps to prolong the life of instruments. When you leave this gross soil on instruments and allow it to dry, what's happening during the drying is, well, for one thing, it's becoming more difficult to remove, and it might actually be possible that some soil gets missed in the cleaning process, in the real decontamination cleaning process downstairs. But also leaving this excessive soil and excessive moisture on instruments promotes the creation of biofilms. A biofilm is a highly resistant to cleaning and disinfecting chemicals. It's a collection of microorganisms that attach to surfaces and to each other to form a colony. You can't see a biofilm because you can't see bacteria in any number. You can't see bacteria. I mean, I suppose if there were 1,000 million trillion quadrillion bacteria in a clump, you would see it, but you're not going to see biofilm. To help you know what biofilm is, you have cats, right, Denise? Okay. So when you pick up and you clean their water bowl, have you noticed that it's slimy on the bottom? Because that's biofilm. That's biofilm. Biofilm grows in ponds, other places where water is standing, and then the bacteria can just start growing in it. So we need to remove the gross soil from the instruments before the biofilm creates. It's not easy to remove. It might take some friction, and especially in instruments where you cannot access all of the surfaces easily, it can be a real problem. Okay, some guidelines for point of use preparation. Gross soil needs to be removed. You should always follow the instructions for cleaning and preparation. For example, flexible fiber optic endoscope manufacturers typically suggest that water and enzymatic solution be suctioned through the scope suction channel at the end of a procedure to pre-clean the suction channel. They also state the shaft should be wiped to remove gross soil. So we're talking about colonoscopies. You know, the scopes that go into someone's colon, where there's often feces and large numbers of potentially harmful bacteria, if those bacteria should transfer from one patient to another. So manufacturers will tell you how to clean their instruments. And that is one thing they will have you do, is suction some enzymes through it at point of use. Also, you should separate reusable sharps. Sorry, I'm having trouble speaking. Separate reusable sharps, things like Gelpies, osteotomes, things that are designed to cut or capable of cutting or poking holes, hooks. There are a lot of instruments that are considered sharps that are, of course, reusable. They should be separated to say all of these in this basket are sharps and all of these in this basket are not sharps. That way it helps the people who are dealing on down the line, transporting and doing the decontamination downstairs. It helps them to stay safe. There are other sharps that are disposable sharps that should be disposed of at point of use. So knife blades, suture needles, and things of that nature. Reusable linen should be separated. This is a almost an opinion, I'm going to say, because every facility is allowed to have their own style of doing things. If their style or the way they do things, their protocol is to send reusable linen down to sterile processing, it still should be in its own bag. Disposable components, things that are sharp, or other things like suction tubes and canisters, they should be removed, disposed of at point of use, which again, some of this may be interpreted differently by different facilities. I've seen or heard of facilities where they just send all the trash down to sterile processing, and sterile processing takes that bag and throws it into a dumpster. Never in any hospital I've ever worked in, though, was that the case.